All right. Hello, everybody. Hello and happy Monday. If you can hear me, if you can see my screen, let me know in the chat, and we will go ahead and get started on our week 2. Oh, can you guys hear me? Let me know if you can hear me. Let me know if you can see my screen. And we will go ahead and get started. Okay, thank you so much. All right. So, hello, like I said, hello, coders, and welcome, most importantly, to another week of our ICD 10 CM Guideline Mastery session. I'm Miss Haley. I'm going to be your lead instructor for this class. I'm so excited to welcome new and returning coders to our Monday night class. I would also like to introduce the wonderful Miss Olga and Miss Vina. You probably have already seen them making themselves known in the chat. They are going to be there helping you guys and encouraging you throughout this class, and we are so excited and lucky to have them with us on this Monday. So if you have any questions, definitely make sure to ask those, and they will be there to help you. So today is week 2. It marks our week 2 journey. So we will be going over and reviewing some infectious disease guidelines. So that is going to include HIV, AIDS, sepsis, severe sepsis, and septic shock, MRSA, Zika virus, and COVID-19 infections. So as always, I'm going to be using our ICD-10-CM guidelines and also referencing the MCG manual in this session as well. So make sure to have those both handy if you can. And we will also be keeping kind of the same flow if you joined us for any of our previous classes. So we are going to do our Jeopardy game just to kind of warm up with some true or false directly from those manuals and from those guidelines, just to test our guideline skills. And then we are going to move on into our in-depth scenarios so that we can really get all the practice that we can for these infectious disease guidelines. And so without a doubt, I'm going to go ahead and get started. And as always, I know I said that my wonderful team is going to be in the chat with you. And if you have any other questions, I think Miss Olga has already posted in the chat the link to our survey. So if you want to ask any questions about anything related to this class, definitely click that or give us some feedback on how we are doing. Is always much appreciated. So I'm going to go ahead and read our copyright super fast before we get started. So ICD-10-CM Copyright 2026, American Medical Association, all rights reserved, fee schedules, relative value units, conversion factors, and or related components are not assigned by the AMA, are not part of ICD-10-CM, and the AMA is not recommending their use. The AMA does not directly or indirectly practice medicine or dispense medical services. The AMA assumes no liability for data contained or not contained. ICD-10-CM is a registered trademark of AAPC. AAPC content found within this presentation is copyright of AAPC. Keyword concept FTR, CHAN, AMCI Fab 7, AMCI ICD-10 Flip, TAP, and MCG are trademarks of AMCI. The credentials CPC, CRC, COC, CPMA, CPB, CPPM, CPCO are owned by AAPC. AMCI does not own the rights to these credentials. The credentials CCA, CCS, CCS-P, RHIA, RHIT are owned by HEMA. AMCI does not own the rights to these credentials. All right. So we are going to just jump right into it. And we are going to start our Jeopardy game. If you are new, if this is your first time here, this is going to be just some true or false. I'm going to stop sharing my screen and grab the game while I'm explaining. But this is just going to be a true or false game just to kind of warm up. So we are just going to be looking at all of these guidelines are going to be taken directly from our guidelines, like word for word, and sometimes I change a little bit of them to make them false. So that is where I'm getting them. And if you have any questions, I will be going over exactly the guideline that I used for each question later on. So if we're going kind of fast, we will slow it down so you can look back and get all of the practice in. So have no fear. I'm just waiting for my screen to load onto the presentation before we go ahead and get started. It's wanting to be difficult today. And then I split, okay, there we go. Okay, perfect. So I've split, our first category is going to be HIV and AIDS. Our second category is going to be sepsis, severe sepsis, and septic shock. Our third is going to be MRSA and Zika virus. And then, so that pretty much. So without further ado, we are going to go ahead and start with HIV lines for 100 just to get started. And as always, put those answers in the chat if we think it is true or false. So our first question is going to be true or false. Once assigned the code B20, which is the code for HIV disease, the coder may never use any other HIV-related code for this patient. Is this going to be true or false? Let me know in the chat and then we will go over it. All right, I'm getting a lot of awesome participation. So this one is going to be true. So one thing that we always, use on here, and you'll also see in the guidelines, is once a patient is B20, they're always going to be B20. I know that there are different codes for asymptomatic and other HIV related codes. But once someone is B20, like I said, they're always going to be B20, and you should always use that code for that patient. All right, let's move on to sepsis, severe sepsis, and septic shock. Let's do a 200. All right, true or false? Coding for post-procedural infections does not require provider documentation explicitly linking the infection to the procedure. All right, what do we think when this has to do with sepsis, severe sepsis, and septic shock? Is this going to be true or false? Let me know. Okay. So this one is going to be false. And again, I'm taking these words directly from the MCG manual. So the correct guideline says coding for post-procedural infections requires provider documentation explicitly linking the infection to the procedure. So assignment of codes cannot be based on assumption of this relationship. So you never want to assume that there is something linked. If it's not documented, then it didn't happen. So definitely don't make any assumptions. And so that is what is going to make this statement false. So if you caught that, amazing job. All right, let's move on to MRSA and Zika virus. Let's do a 300. Okay. True or false? For a patient with both MRSA colonization and infection during admission, Are we assigning both Z22.322, which is the MRSA carrier or suspected carrier code, and the appropriate MRSA infection code? So are we coding both of them in this instance? Is this going to be true or false? All right, I'm getting some awesome answers. So yes, again, all of these statements are taken directly out of the MCG manual, directly from the guidelines, and so um, it would be easy. You can just not it would be easy, but you can look through those, if you need like a little refresher. I would not know this, off the top of my head on the spot. So that is where you would be able to find them. That's why I put them in different categories to make it kind of easier if we need to look them up. So this one is going to the patient has both MRSA colonization and infection during the admission, you will code both the MRSA carrier and the MRSA infection code. So a lot of people got that one right. If not, hopefully we learned something. That is why we are here. So keep up the participation. And now we're going to move on to some coronavirus infection guidelines. Okay, true or false? When a patient has resolved COVID infection and no active symptoms or infection, use code U07.1, which is a COVID code, should still be assigned. So if a patient has resolved COVID, no active symptoms or infection, are we still using the COVID code? True or false? What do we think? All right, I'm getting some mixed reviews on this one. So this one is going to be false. This one is going to be false. If you look again in the guidelines, it will say for follow-up visits after COVID-19 is fully resolved with negative test results and no residual symptoms or conditions, that you should instead assign code Z09, which is encounter for follow-up examination after completed treatment, or you could use a personal history code of COVID-19, which would be like a Z86.16, but you would not still use the active COVID code if it is resolved and there's no active symptoms or infection. You would use either one of those other codes. So if you caught that, amazing job. That was a 400, so that one was a little difficult. Okay, now we're going to go back to our HIV and AIDS. We're going to go for 200. You can also find these guidelines in your ICD-10 look at the guidelines. They'll be the same. They're just organized a little bit differently, but the sections will still be the same. So if you don't have your MCG manual yet, not the end of the world. All right. So, yes, for the HIV and AIDS section, true or false, when a patient encounter is for HIV testing and the patient has signs and symptoms, but the results are negative, code the presenting signs and symptoms. True or false? Let me know in the chat. Okay, so this one is going to be true. This one's going to be true. This kind of touches on kind of the guidelines that we went over, the general coding guidelines. So when there's not, a definitive diagnosis, or in this case, they coded for, or they tested for HIV and it was negative, so there's not a direct diagnosis, then you would just code the signs and symptoms. So it's the same for this. If someone comes in thinking they have HIV but it's negative, you're just going to code those signs and symptoms, because we can't code the HIV because they tested negative for it. So that is why this statement is true. So if you got that one correct, amazing. If you learned something, even better. All right, now we're moving back to sepsis, severe sepsis, and septic shock. Let's do a 300. Again, true or false, for severe sepsis coding and sequencing. So, when present on admission and qualifying as principal diagnosis, code the systemic infection first. So, this is a sequencing question. Let me know if we think this is true or false in the chat. Okay, I'm getting an overwhelming true, and indeed, this one is true. So, yes, if severe sepsis is present on admission and qualifies as a principal diagnosis, of course, yes, you should definitely code this systemic infection first. You guys are indeed rocking. Keep it up. Keep it up. All right, let's move right along to our MRSA and Zika virus guidelines. Can do a 400. This is a long one. Okay. True or false? For MRSA infections without combination codes, so an example of this would be wound infection, stitch abscess, or UTI, assign the specific infection code plus B95.62, which is MRSA as cause. So do not add a penicillin resistance code. I know this one's kind of a long one, so I'll give you all a few seconds to look this one over. Let me know in the chat what you think. Okay, I thought this one was would be a little tricky, but everyone seemed to get this one right. This one is indeed true. I feel like the MRSA guidelines have a lot of sequencing with them. So yes, that is how you would assign the MRSA infection without a combination code. So great job. Keep it up, keep it up. And we are going to go back to our coronavirus infection. We'll do a 200. Oh, my goodness. Okay. For patients presenting with signs or symptoms commonly associated with COVID, like shortness of breath or fever, but without confirmed exposure and where the test result is negative or inconclusive, assign code for COVID-19 exposure. Okay, so this one is indeed going to be false. So again, looking at these guidelines, you're going to see for patients presenting with the signs and symptoms associated with COVID, no confirmed exposure, test results are negative or inconclusive. You're going to assign codes only for the reported symptoms. So you're not going to assign codes for COVID-19 exposure or related conditions in the absence of supporting documentation. I cannot read today. Oh my goodness. So yes, so that's what would make this one false. You wouldn't code for COVID-19 exposure because they don't have confirmed exposure and the results are negative or inconclusive. So I hope that makes sense. Again, after this, I will go over the specific code that I took these from if we need a little bit more insight as to where I got these. So no worries at all. But if you got that one right, amazing job. Still got a few more left. We'll go back to HIV and AIDS for 300. If a patient has a positive HIV test result but no symptoms or conditions, B20 should still be coded. True or false? Okay, I'm getting a little split on this one, getting a little split. So this one is going to be false. So the reason this one is false is because if they don't have any symptoms or conditions, that is going to make them asymptomatic. And there is a whole different code that you're going to use for asymptomatic. So that's going to be Z21. Those are going to be the two top codes you're going to use when you're dealing with HIV patients. So Z21 is when the patient is test positive for HIV, but there are no symptoms or conditions. So that's what makes them asymptomatic. And so they would use code Z21 instead of code B20. So if you caught that one, great job. Hopefully we learned something. If not, and we'll go back to our MRSA and Zika virus for 100. Okay, true or false? MRSA or MSSA colonization means bacteria are present without causing illness, indicated by positive screen or positive nasal swab. True or false? Okay, so this one is indeed going to be true. So yes, this is what the colonization means. It just means that the bacteria is present, but it's not causing illness. So it would be, yeah, indeed, it would be indicated by a positive nasal swab or that screen. So I think pretty much everyone got that one right. Great job. Oh, I forgot to do our sepsis one. Okay, let's do this septic shock. Okay, true or false? Still assign severe sepsis if the organ dysfunction is unrelated to the sepsis. True or false? Let me know in the chat. You guys are doing great. All right, I'm getting an overwhelming false, and that would be correct. It is going to be false. So, yes, the guideline is to 100% do not assign severe sepsis if the organ dysfunction is unrelated to the sepsis. So, everyone caught that one. Outstanding, outstanding job. Keep it up. And we are going to go back to our coronavirus infection for 100. Again, true or false. So for confirmed COVID-19 with pneumonia, this is going to be a sequencing question. So confirmed COVID-19 with pneumonia, assign the COVID code first, followed by the pneumonia code to specifically identify pneumonia as being caused by COVID-19. So how are we sequencing this code? True or false? Oh my goodness, you guys were so quick with this one. Yes, this is definitely true. That is how you should code a COVID-19 with pneumonia, with the COVID first, followed by the pneumonia code. So that is 100% true. Great job. All right, now for our final HIV and AIDS question. True or false? Use R75 when the provider cannot determine whether the patient does or does not have HIV or AIDS, and there are no documented signs, symptoms, or definitive diagnosis. Let me know in the chat. All right, indeed, this one is true. So, yes, when a patient arrives at the doctor's office to receive HIV test results and the results are inconclusive and the patient also has no signs or symptoms, you're going to code R75. So that makes this statement correct. And I think everyone got that one right. So, yes, indeed, spot on. That was a great way to end that category. And now for our last sepsis, severe sepsis, and septic shock. When coding sepsis, always sequence the systematic infection or causal organism as the principal diagnosis. True or false? All right, this one is indeed going to be true. Okay, so yes, you are always going to sequence the systematic infection or the causal organism as principal diagnosis. Great job on that one, everyone. All right, and then our last MRSA and Zika virus. All right, for Zika virus, code only for confirmed cases documented by the provider. I know you guys got this one. True or false? All right, of course, this one is going to be true. So, yes, this is pretty much true for any um, case. You always only want to code confirmed cases documented by the provider. Zika virus is no exception, so that makes that true. Outstanding. All right, and then our last question from the coronavirus infection. Let's end on a good note. Okay. True or false? Assign U07, which is that COVID code, for confirmed COVID 19 cases, regardless of whether the patient exhibits symptoms. All right. And this one is indeed going to be true. So, yes, you're still testing positive for COVID 19. It's still a confirmed case. So, even if they're not exhibiting symptoms, you would still code that. All right. And I think everyone got that one. So, we did really end on a great note. Great job, everyone. I'm going to stop. Oop, I did not mean to hit my mic. I'm going to stop sharing my screen really quick. I'm going to move back really quick to our PowerPoint before we move on to our in-depth scenarios, just so I can let you guys see, like I said, if we have any questions about the specific guidelines that I used, I will click through them super quickly. And this is going to be a recorded video. So if you want to look back, and you can pause this presentation as much as you need to. So you can always look back. So once they're here, they're not going to be gone forever. So, whoop, okay. So this is going to be from our HIV and AIDS section. This is going to be the questions that were asked, the answer, and then followed by the guideline that I used. And the guideline labeling is going to be from the MCG manual, but you can also find them in your ICD-10 manual as well. They're going to be the same guidelines. So that's going to be for HIV AIDS. This one's going to be from our sepsis, severe sepsis, and septic shock section. Oh my gosh, cannot say that 5 times fast. Question answer guideline. Same thing for our MRSA and Zika virus section. And then last but not least, our coronavirus infection section. That was fun. Our question, answer, and guideline. Okay, so how are we feeling? We are going to move into some in-depth scenarios. So again, we're going to be doing, if you've attended a class before, we're going to be doing our in-depth Quizlet scenarios where we're going to break down a scenario from our keywords, our guidelines, and then our ICD-10 codes. And then if you're new, we're still going to be doing the same thing. So I'm going to give you a scenario and then you're going to put your answer in the chat once again. And yes, it's going to be the same scenario. We're going to pick out and break it down through keywords, then our guideline, and then last but not least, our final ICD-10 codes, just so we can fully grasp how to break down a scenario using our guidelines and fully master these guidelines at that. Okay. So here is our first scenario for the night. So a 68-year-old woman is admitted through the emergency department with fever, chills, altered mental status, and profound hypotension. Oh, that is not the first situation. Please ignore me. It started from the end. We're still going to use that scenario. I'm so sorry. It restarted on me. Just ignore me. That'll be the last scenario we do. Okay, this is the first scenario. Okay, so a 68-year-old man presents to the emergency department with fever, cough, and shortness of breath. A COVID-19 test is positive, and the physician diagnoses pneumonia due to COVID-19. So the patient is admitted for treatment. What keywords are we taking out of this scenario? Let me know in the chat and then we will go over it in just a few seconds. All right, indeed. Everyone put the correct. Yes, so we have our signs and symptoms, which are our shortness of breath, fever, cough, and then we have our confirmed, important confirmed, pneumonia due to COVID-19. So amazing job. Everyone got those keywords. And next, we are going to move on. We are going to use the same scenario, but now we are going to use, or we're going to select the ICD-10-CM guideline to best describe this encounter. Again, to make it a little easier, it's going to be from the coronavirus, the COVID-19 section guidelines. So we can kind of narrow it down to what that's going to be. You can either put the title name or you can put the number. However you want to do it, just put your answers in the chat and then we will move on to our guideline or our codes. Oh my goodness. All right, I'll give you guys a few seconds. All right, I have some people already putting those guidelines in. So, yes, it is going to be our IC1 G1CI, which is going to be acute respiratory manifestations of COVID-19, pneumonia, which everyone put in the chat. So, great job. And last but not least, we are using those keywords. We are using that guideline, and we are going to select our ICD-10 CM code or codes that best describe this encounter. And I will switch over to the PowerPoint so we can see how everything looks all together. So make sure to put those answers in the chat. Okay, if you are still solving, no worries. I'm not going to give the answer away right now. I'm just going to switch over to our PowerPoint so we can look and see how everything looks all together. All right. So, like I was saying, this is going to be our scenario. I won't read it all over again, but we did take out the keywords of our fever, cough, shortness of breath, and most importantly, our pneumonia due to COVID. And this is going to be the guideline that everyone selected, that IC1 G1CI, which is going to be our acute respiratory manifestations of COVID-19 and pneumonia. And this one works out really nice because we have our sequencing guide right here on the right side. So it's telling us that we definitely should sequence our COVID-19 first, which is going to be our code of U07.1. So when you go into the ICD-10 book, you find the code U07.1 for COVID-19. And even if you look down here, it gives you further instruction if you didn't see it right here in the guideline sequencing suggestion. It even says down here in the notes, use additional code if applicable for associated conditions such as, and then right here you see pneumonia due to COVID-19, and then it gives you the code right here as well as in the guideline as well. So that's a pretty big indicator of what our second code is going to be, and that is going to be our J12.82, which is going to be pneumonia due to coronavirus disease 2019. And it even says, if you want to double check, it even says in the notes under the pneumonia due to COVID-19 to code first COVID-19 and gives the code. So there are a lot of indicators on how to correctly code this scenario. And everyone seemed to get it right in the chat as well. So I think that was an amazing first scenario to kind of dip your toes into these infectious disease guideline scenarios. So if you got that right, amazing, amazing job. And we are now going to move on to our second scenario of the night. I will switch back over to our Quizlet super quickly. Hopefully it doesn't restart on me. Okay, perfect. Okay, so our second scenario is going to be a 38-year-old woman with a known history of HIV disease presents to the hospital with increasing shortness of breath, fever, and non-productive cough. After diagnostic testing, the physician diagnoses PCP or pneumocytosis Durovacine pneumonia, that's a mouthful, due to HIV disease. So PCP due to HIV disease. What keywords are we taking out of this encounter? Let me know in the chat. All right, indeed. So, yes, we have our history of HIV. We have those signs and symptoms, which were the fever, shortness of breath, and non-productive cough, and then also, most importantly, our PCP due to HIV. All right, and now next, we know what we're going to do next. We are going to pick our guideline that best describes this encounter. Again, to kind of narrow it down, it is definitely going to be in the HIV and AIDS section of your MCG manual or your ICD-10 manual. So let me know what we think in the chat, and then we will go over it. All right, getting some answers in the chat. So yes, what we're going to be using is our IC1A2F, so HIV infection, select when, oh my gosh, I cannot talk. 8 months pregnant, pregnancy brain, and Mondays. Do not mix, y'all. So, selection and sequencing of HIV codes, previously diagnosed HIV related illness. I know that one was a little difficult, but everyone seemed to be on the right track. So, great work. And now we are going to move on to our specific ICD-10-CM code or codes, and let me know what we think in the chat, and then I will move to our PowerPoint and we will go over it all together. Okay, if we are still working on it, no big deal. We're just going to switch over to our PowerPoint. But I'm getting a lot of awesome answers in the chat already. Great job. Okay, so like I said, we have our scenario right here. What we're taking out of it is going to be that history of HIV, our signs and symptoms, and then our PCP due to HIV. So this is going to be the guideline that we're going to be using. And we're not going to code for our signs and symptoms because, again, we learned from last week with our general coding guidelines that if the signs and symptoms are integral to a disease, then you do not code them because it would just be, extra codes for no reason. So all of the signs and symptoms are going to be due to this PCP due to HIV. So we don't have to code for any of those. And then if you look again at our sequencing selection right here on the right side, our first code is going to be our B20 code. We know that's true because we see that they have the history of HIV. And again, once someone is B20, they're always going to be B20. So that is going to be our first code. So B20, human immunodeficiency virus, so our HIV disease. And then our second is going to be our HIV related illness. And so again, if we look at our keywords, we see that the illness is going to be that PCP, that pneumonia. So if we look into our ICD-10 book, we are going to find our code for B59. So this is going to be our pneumocytosis. And then if you look down here, this is what it's going to include that PCP. So that is why we're selecting that code as our second code, because again, it is going to be the HIV related illness. And if you look in the sequencing suggestions, that is going to be coded second. And that is why these are going to be our two codes. And if you got that right, which everyone got that right, or they were definitely on the right track. So hopefully, if we didn't get it completely right, hopefully that the explanation and the guideline selection kind of made sense for that one. Definitely, I agree. Great job and great forensic coding. So keep that up. And then we are now going to move on to our last scenario of the night. So let's end on a great note. I'm going to switch back over to our Quizlet. And I already kind of read it, so we kind of have an idea of what it's going to be. Okay. So, a 68-year-old woman is admitted through the emergency department with fever, chills, altered mental status, and profound hypotension. Blood cultures later identify E. coli as the cause of her infection. The physician documents sepsis due to E. coli with septic shock. So, what keywords are we taking out of this encounter to help us select those ICD-10 codes? Let me know in the chat, and then we will go over it. Okay, I'm getting some awesome responses in the chat. So yes, we are going to be taking out those signs and symptoms, which were the fever, chills, hypotension, and then the sepsis due to E. coli, and then the sepsis due to E. coli with the septic shock. For sure. So everyone got that one right. No surprise there. And now we are going to be moving on to our guideline selection. So again, to narrow it down, it's definitely coming from that sepsis, septic shock section that we were talking about earlier in your manual to kind of narrow it down. So let me know what we think that's going to be, and then we will go over it. Okay, I know we're running a little low on time, so I will go ahead and let everyone see what the guideline is going to be. So yes, so it is going to be IC1D2, which is going to be our sepsis, severe sepsis and septic shock infections, resistant to antibiotics, and most importantly, our septic shock. So we have some people that did select the right code in the chat already, so that's amazing. If you're still looking at it, definitely still put those answers in the chat. But now we are going to move on to the last part of our last scenario. So using that guideline and using those keywords, we are going to pick our ICD-10-CM code or codes to best describe this encounter. I will give you guys a few seconds, and then we will switch over to our PowerPoint one last time and go over it all together. And yes, to answer somebody's question, yes, thank you, Ms. Vina. Beat me to it. Yes, all of these videos are going to be pre-recorded. So if you got here, a little late and you want to see the whole lecture, you can access the recordings by going on our YouTube page like you are right now. And then you just click on the live section and you can see all of the live videos that are classes that we've previously had. They're all recorded, so you just have to scroll down and you'll be able to access them. And you can click on the live chat too, so you can kind of see how people put their answers in the chat and stuff during the live video too, which I think is pretty cool. All right, so yes, I'm going to go ahead and switch over. I won't give away the answer, but I'm going to switch over to our PowerPoint since everyone is already putting those answers in the chat. All right. Okay. And here we go. So again, this is going to be our scenario. What we're taking out of here is going to be our history of HIV. Wait, what? What did this do? We already did this one. I was like, HIV? What are we talking about? Okay. Whoops. Okay, my goodness gracious. Okay, so yes, so we're taking away those signs and symptoms, which are going to be those fevers, chills, altered mental status, and the profound hypotension, the sepsis due to E. coli, and are specifically sepsis due to E. coli with septic shock. So this is going to be our guideline that we're going to be using. Again, this is clipped right from the MCG manual. So if you look here, as always, super helpful, we have our sequencing suggestion right here. So our principal or our first listed diagnosis is going to be the specific underlying systemic infection, or A49 if it's not listed, if we need to do a generic one. But since we have ours, again, we took from our keywords, it's going to be our E. coli is going to be the infection. So that is going to be our first code. So it's going to be our A41.5. So our sepsis due to other gram-negative organisms, and then you look, this needs 5 characters, so you would look down and you would make the selection of A41.51, which is going to be sepsis due to E. coli. And then if you look back at the sequencing suggestion right here, you see that you can either do R65.21 or you can select a different code. In this case, we are definitely going to be using our R65.21, which is going to be the severe sepsis with septic shock. Again, because it specifically states here, and it is also a keyword that we took out of this scenario as well. So you definitely need to code that septic shock. And those are going to be the codes that we are going to pick for this scenario. So if you got that right, amazing job. Or if you were on the right track, I hope that the explanation kind of made sense to put everything together and add those extra codes if we needed to. You guys did absolutely amazing tonight. Amazing job, amazing job. But if you do have, again, this is going to be recorded like we were saying, so you can look back on it if you need extra practice. And if you have any extra questions in the meantime, or if you want to provide us feedback on how our classes are so we can better improve the classes for next time, so you guys can get as much learning as you need to out of these classes, definitely click Miss Olga put in the chat again the link for the form. So definitely click on those and let us know how we're doing or ask any questions and I will get back to you. Thank you guys so much for attending the class tonight. I look forward to next week for week 3. It is going to be here again, same time, 7 p.m. So thank you everyone for attending and I hope that everyone has an amazing rest of their night. Thank you to my team, Miss Olga and Miss Vina, as always. Thank you guys so much. See you next time.
4,000 exam passers and free classes at AMCI. Learn to coach straight from home or on the road at AMCI. We're on the East Coast, the West Coast. We're all around the world. AMCI, AMCI.